Hi, Dr. Renuka. How are you doing?
Hey, hi, I'm doing good, Preeti. How are you doing?
I'm doing well. As I said, it's great to see you. It's been since 3 years since we met in person, but we've been in touch over phone
Yeah.
calls and regularly been in touch. So we've been um, updated with what's happening. So, but tell me a little bit more about yourself. Tell the audience a little bit more about your background, your passion for the space of health and wellness. Tell them a little bit more about that.
Yeah. Yeah, hi, I'm Dr. Renuka Anvekar. I'm from Bangalore and I have my own private practice. I'm an Ayurvedic doctor basically, and I have my Panchakarma treatment center in Bangalore. This is in RT Nagar, and I have almost 30-year practice which I've been tackling. And I'm also into the yoga space right now. I'm into education and a lot of things. I have already been trained as an emotional counselor from Banjara Academy, and I do the non-directive Rogerian method of counseling. So it's a bag full of things that I do.
Yeah, so but what got you, what was your inspiration? You're a doctor, you're wearing several hats, you're doing education, you have yoga studio, you have your Ayurvedic practice. So what got you really excited about exploring the health and wellness coaching space? What was it that kind of said, I want to do that? What was it for you
Yeah.
specifically?
Basically, Ayurvedic, as an Ayurvedic doctor, I tackle a lot of these lifestyle disorders. And lifestyle disorders are not communicable. And in the way the lifestyle disorders get to you is very insidious. It takes decades to actually form. So to get the person back into a lifestyle where they did not have that disorder takes a lot of discipline, and they really have to work very hard. And motivation is very hard to find in these situations. They kind of slip down, and when we tell them, don't do the things you've been doing all along for 10 years, it's very difficult for someone to actually follow that. Even as a doctor, I am directing them to do it, but unless that inner person is not going to take over and really do something about it, they are going to slip back. And then they are again going. It's like a snowball effect. So the lifestyle is never going to get, it's never going to end, and they're never going to get better. And it's going to get from bad to worse. So here, I used to find a difficulty in actually pinpointing and telling them at what point they would be able to take over by themselves. It's all along being like, I'm going to tell you these things, you do it. Again, they come after another 3 months and they're HbA1c level as before. And I wanted to find a point, the tipping point, which I found when I came in over there. This is what I found it was very educative for me because I was already doing counseling. I wanted to know where it is that I can really, forge ahead and tell them this is the point where you can actually take over. I wanted to be in control of that point too, to see where they will be able to tip into that, taking the onus onto them, empowering them, and not wait for a doctor. I'm paying a doctor this much as my consultation fee, and I need her to do everything. I can't do the dieting for them. I cannot do their exercise for them. I wanted to reach a point within them where they should be able to take over and say, no, this is where I have to step in. Nobody else is going to help me but myself. So that's what got me interested into this wellness space. Health I was already doing, but I wanted to take them from that illness to the wellness part.
Yeah, and you
That,
had
that,
many years of practice, right? What, 20, 30 years before you did this
yes,
program?
yeah, I did.
Yeah, so you were somebody who had extensive practice. You come on television as well,
Yes.
and you do so many interviews. You have so many clients, and it's interesting to hear from you that you've been using the advising counseling approach, but somewhere the clients were now taking accountability, and somewhere
Yes.
that vicious cycle of lifestyle disease, the loop, they were not able to pull themselves out, because at the end of the day the accountability lies in the client's hand to take charge of their entire life. And this experience, you thought, you'll come into the course and you'll learn how to do that, and you will apply that in real life in your practice, and looks like you have applied that. So tell me, what is the shift that has happened within your client space ever since you've added coaching along with your counseling and consulting as a doctor? What has shifted that for your clients?
One word: sustainability in whatever they are taking.
Yeah.
Responsibility about their, what the lifestyle changes that they are doing with their lives. Almost a year, which is very good according to me, because HbA1c, we are going to check once in 3 months. So if I'm going to see four of that and all of them are reducing, I feel really great. A year is very good for me. From before, when I'm seeing that not even two HbA1cs are in line, seeing four of them as I'm watching the file and it's coming down 8 to 6 to 5. And it's amazing because nowadays diabetes is reversible. So we are working towards that, and I'm noticing all these changes happening. They are very sustained in their efforts. They feel good, and they validated themselves, their well-being. So that's where I'm seeing the big change which has come after I have introduced this approach in my practice.
Yeah, so the sustainability, and we see that all around, right? Whenever I meet a lot of my clients across the country, even abroad, for you as well, what you've seen is clients kind of pick up a goal, but the stickiness with the goal isn't there. They kind of
Yes,
do this thing for 2 months. They sometimes, even if it's weight loss or trying to get their HbA1c sugar levels down, they do it for a few months, then they fall back to their previous habits, right?
yes,
Because habits, the formation of habits happen from our brain, from the
absolutely.
because of the way the neurons are communicating, and the way we use coaching and the behavioral science behind it allows them to come into the space of taking accountability and forming these habits, negative habits and forming positive habits, would stick with them for a longer period of time. So you have people who've stuck with you with the same changes for more than a year, which is really, really great. And by the end of the year, it has become an innate part of their psyche. It has become innate part of your
Yes,
psychology. So tell us a little bit more. You came into the program, you had the chance to meet a lot of people from different parts of the country. How
yes,
was that experience for you to go through the program at a personal level?
yes. See, this was one more thing that actually attracted me to the program. Meg was coming, and you
Yeah,
were there. Both of you, your fame preceded your names actually when we had attended that program. And this group, the diverse group that we had there, it was amazing. We met someone from Mangalore, someone was a coach, a sports coach, and someone was already having a diet meeting. There was a lactation consultant, there was a yoga teacher, there was a nutritionist over there. It was just amazing, that kind of camaraderie that we shared for those 10 days and what we could exchange. That was amazing. And learning in such kind of environments actually makes a difference. It's, like I would always prefer to go somewhere in person and learn it in flesh because you have lots of inputs there, which you can really appreciate. So I would prefer to go to a place and learn. And that really helped me a lot. The 10 days that we spent in Delhi, away, it was 10 precious days for me away from my practice and from family, but it was worth every minute that we spent over there. It was great.
so I'm so happy to hear that. So what was the personal shift that happened for you at a personal level? Anything shifted for you? Because what I have seen, everybody who's done the program, whether it's in person or online, goes through some sort of a transformative shift. And we actually witness the cohort going. And I remember when I did the program, I went through a lot of personal changes in terms of how I looked at life and how I looked at my own health and well-being. So tell me a little bit more about what happened for you personally. What changes did you make? Any changes? Did you learn something new about yourself?
See, I'm a person who actually reinvents myself very often for the better. So on
Yeah,
that part, this was actually my learning which happened that year, right? That year I had earmarked myself. I actually go on adding certificates to my education qualifications every year. So
yeah.
2017 was for the health and wellness coaching. And after that, I did a lot more. I went into my Bhagavad Gita studies, and then I got into yoga teachers training, and I got trained at some place called Krishnamacharya Yoga Mandiram, which is in Chennai. That's one of the best things. That's the next best thing that happened to me. So that way, it was like it's a upward slope.
Yes,
That
it
was
was.
what has happened.
It has been an upward slope for you. You're somebody who always keeps learning and exploring and evolving and growing. Tell me if you had a message. There are a lot of people who now in India, when you did the program, it was the first certification program, and we've already done eight to. We are on our ninth one right now. So we. What would your message be for people who've just finished the program or who are wanting to do the program? What would your personal message be for the aspiring health and wellness coaches of the country today?
Yeah. See, we are really entering because the age of technology, we are not doing a lot of physical stuff, and lifestyle disorders are looming very, very large. And people do need a hand holding for some, for them to get back to their wellness. So this is the best place to time to enter the health and wellness coaching. See, I'm not going to talk much about the coaching and what is going to the monetary benefit that is going to come in, and that is part and parcel of it. But as humans, when we are doing this coaching and you're helping someone to come out of a real and the gratefulness that they express after that, that's very gratifying for us. Being a doctor, I feel that too. That I mean, my first client was on the phone. He had just come down from the US and he told me, "Doctor, I'm going to be your first person." 3 months later, I'm seeing that he went into a bariatric surgery and started slimming down. He took a drastic step, but still, he took who would go for a bariatric surgery just like that? Just
Yeah.
a few minutes into coaching, and he had said, "I'm going to really take control, doctor, now." And he went and he took that step. And he's doing fine now. He almost lost 40 kilos of his
Yeah.
body weight. Even taking something drastic, something like a bariatric surgery onto yourself, also, you need somebody to tell you, now you
Yeah.
got to take charge of yourself. So all these things happened, and I feel that it's more gratifying because you're helping someone to really come out of something like a lifestyle disorder. Because as I already mentioned to you, it's something very insidious, and it catches up to you very slowly. Before you realize it, you're 20 pounds overweight. Before you realize it, it just goes on, and you can never go back on your own. So you'll be actually looking, you're looking for a blade of grass in the water. Okay, I'm going to go down to something, and they are
Yeah.
looking for help. You're helping them like this. It's something really great. And of course, the money is good too. So commercially also it works very well. And
Yeah.
I think there are not many health coaches right now. So this is the best time to get into it. Now big hospitals are actually asking, and I think you helped me out with one letter of recommendation because they wanted me to come and start the health and coaching wellness department in that hospital. So
Yeah.
that was amazing, and that's what I think. And from your end, you are even doing handholding now. 3 years later, you're still asking us, how are you doing? And you gave me that letter recommendation. That is a great thing that you did too, Preeti. So this is how, you're taking responsibility of the people who have already been in your coaching institute. So that's a
Yeah.
good one.
Yeah. So thank you so much for saying that. You talked about, somebody who is in problem, in a health crisis. He's just looking for that strand of grass that you said, and it's so powerful that just a little bit of that support, little bit nudge in the right direction to take accountability. Though, you're a doctor, you can talk about bariatric surgery. Obviously, in the coaching space, we can't. So I'm putting a disclaimer there. But you're a doctor, but while coaching that person was able to take a decision and took accountability and has lost 40 kgs. That his life would have transformed, and this was only all through telephonic. So,
Yes,
70% of the coaching all around the world is happening telephonically and video chat, just like this. So it's so powerful that you could be sitting anywhere in the world and you could be helping the world change as a coach. Because of, you talked about technology, because of accessibility of technology, you're not limited to one geographical area. You can have clients from all over the world, as long as you can service them. And there is such great, you said, there's such great gratitude, because the clients also explain they are so grateful. They have so much gratitude for what, and it's so satisfying for the coach
absolutely.
to receive that gratitude. And when people like you, they don't mind paying for you. When they really
Yes,
like you and they're benefiting, they find value from it. So the coaches can create a great life for themselves. So what's in the future for you, Dr. Renuka? What are your hopes from the healthcare industry? What is your hope from the healthcare industry?
Yeah,
Yeah.
now since I'm already in the illness space also, now I'm going into yoga. So I want to make a package like, health coaching for weight loss, especially. A lot of weight loss happens at my place because we are Panchakarma and other things. And then other things like, diabetes. That's the biggest thing that you can handle. And as the corollary to that would be heart disease too. So we would like, I would like to enter into that space and get into the diabetes space reversal. So I want to go into that with coaching, and that's one of the diseases or disorders. I wouldn't call it a disease. It's a disorder that can really benefit with the health coaching.
Yeah.
Diabetes. how you could really reverse and help them to stick on to that goal of eating right and doing an exercise program and yoga. So I'm looking at that space now. Seriously looking into entering diabetes reversal because that's the biggest the cloud that you're seeing overhead right now. Every other person, three people, if they're a family of four, three of them are already pre-diabetic. So when you catch it at that point, and then there's no looking back. You were talking about habit forming, so I'm looking at neuroplasticity of the brain too, which will really, you can really do something about the neurons and the connections that are going to happen, and you kind of work on it so well that your the whole thing is changed. It's like recanalization of the river. So you kind of do another network of nerves, which is going to say what you were doing when you went into that abnormal space was wrong, and this is my me, and I'm going to do it the right way. So your neuron should be able to tell you you're on the right path. Feel good.
Yeah. So that's great, right? I think you just said that health and wellness coaching possibly could be the solution for lifestyle diseases and specifically for diabetes, because coaching them can really help transform lifestyle habits, whether that is nutrition, exercise, stress, smoking, alcohol, whatever may be the root cause of
Very
diabetes for them. And it could really help them in having longevity, in some cases also reversible, especially in pre-diabetes and sometimes even in diabetes. You can see reversal. I think you've seen that as well. So it is highly possible. So we can actually transform the health coaches. Health and
yeah.
wellness coaches can really transform the health of the nation and well-being of the nation, move India closer to being a healthier, happier nation, right? So
It's been called the diabetes capital now. I mean, cities are literally called that. So I was looking at something like that only, where diabetes, you can really work on it and use the health coach approach and get them back to the non-diabetic state. It is,
yeah,
we have done, we've worked with Ayurveda and other naturopathy and other things, where the insulin
yeah.
level, we were taking patients off insulin also.
Yeah. So which is great. What amazing news for India and for aspiring coaches, because the landscape of people struggling with this and landscape of people who may be needing health coaches now in the near future is just going to
Yes.
be is going to exist. And if we can help people become healthier and happier, live longer, but also have greater quality of life, not just live longer but having greater quality of life, that's such a great thing. So thank you, Dr. Renuka, for this amazing work that you're doing, and my heart reaches out to you that may God bless you with the greatest choicest blessings in life, and may you continue working the way you're doing with your clients and learning and growing and impacting so many lives that you are today. So take care of yourself, and obviously we're going to stay in touch.
Thank you so much, Preeti. It's great being with you.
Yeah, I'm just going to turn off the recording and we're still going to talk.
Yeah, yeah, yeah.